Clearly, March of Dimes has been hugely successful and important on a whole range of issues. And one of my questions would be how you see all of the things you've just talked about in terms of prioritizing breastfeeding. How do you see that in terms of the range of other priorities for March of Dimes? And how do you see ABM and other groups here working with you? Because it really sounds fabulous. I'm so excited about it, Cindy, and really appreciate all of what you shared about breastfeeding.
Sorry. There we go. Well, certainly this is an issue that's near and dear to the March of Dimes, right? I mean, our mission is healthy pregnancies and healthy babies, and this is an incredibly important issue for healthy babies. I think, at least from my perspective, since I oversee both federal and state government affairs for us, there are different sets of opportunities on the federal level and on the state level in various places, right? And particularly because looking at the 50 states, there are different opportunities all over the place. It can be very hard to sort some of those out. And a real challenge for our local advocacy staff to figure out, wait, what has my state done? What has my state not done? So, doing things like partnering with our Title V directors is critically important for our chapters, and something that we recommend that they do to try and, so that they frankly don't have to invent the wheel in terms of expertise, right? They can say, here's what's already happened, here's what we need to do next, and let's focus on figuring out what the barriers are and how to get past them. On the federal level right now, I think most of the opportunities are on the regulatory side rather than the congressional side, right? To be honest, we probably don't want Congress going too close to the Affordable Care Act anytime soon, certainly not to these provisions. And so it behooves us to give them a little bit of a rest. It's great to see things like the TRICARE amendment, but I think the majority of the opportunities there are going to be on the federal level.
I would just agree with that, and anyone that doesn't know their Title V director, please come talk to Carolyn or I, and we'd love to put you in touch. Title V leaders are often the conveners and the people that get things done at the state, and so often on multidisciplinary teams and task forces with their March of Dimes chapter representatives, so happy to help.
Kathy?
Thank you both for your presentations. They were very informative and nice putting everything together for us. Cindy, Kathy Marinelli, we've known each other a long time, so I'm on the ABM board and I'm USBC chair now. I met you long ago when I became chapter breastfeeding coordinator for Connecticut, and I'm still doing that job. So you've left the AAP, but I'm still there. You mentioned that it might be a good idea for some organization to take on some kind of model policy for the Affordable Care Act in lactation. Actually, the United States Breastfeeding Committee worked with the National Breastfeeding Center, and we published that exact document that you're talking about back in, I think it was September of last year. So if you go to our website for the USBC, which is www.usbreastfeeding.org, we have that model policy there, and it's actually written for the insurers, so it's written in their language so they understand what should be given to mothers in a variety of circumstances in terms of both the pumps and what kind of lactation care is out there. So we're hoping that that helps inform them, but anyone can use the document and it's freely downloadable. So it's already been done, it's out there.
Then we'd like to work with you on dissemination.
We would love to work with anybody on dissemination.
We went looking for something like that and we couldn't find it.
We just updated it because of some change that has occurred in the ways that there are, many folks out there that can provide lactation care. So we changed some language so that it makes it clear that there are lots of folks out there that can provide lactation care. Yeah. So it's just recently been updated, but we would love to work with you. I'll give you my card, and we would love to disseminate that document.
Well, that'd be great, because I think, there are all 50 of our chapters, I think, would be interested in having that in hand to be able to go to policymakers and say, this is what we need to be covering, here's what we hear is happening in our
We
state.
want it out there.
And, and we should be getting it out into the full maternal and child health
We spoke
community
to the
so that everybody
Medicaid
knows
folks
it's
about
there.
it when we met with you guys.
Yeah.
We met, actually. We did, trying to get it out on that side of things, and we're happy to disseminate that document. And anyone here can go and download it as well and use it to help you with your arguments with the insurers over what's appropriate and what's not appropriate. So we'll talk.
Thanks for saving me a bunch of work.
No problem.
Okay, I want to say a little something about the AAP and what we're doing. Now the Affordable Care Act is passed and it's the law of the land and it's underway, the action really is at the state level. And how are the states implementing the Affordable Care Act? And the AAP, through its chapters, and its chapters essentially each state, are working very hard with the insurance people and the medical directors at the state level to make sure that the essential health benefits necessary for good maternal and child health are being included. Unfortunately, for the commercial insurers in particular, their insurance plans are designed for adults. They're not designed for children. They're not designed for mothers or nursing mothers, et cetera. They're really looking at the big adult population overall, and they don't understand some of the special needs of children and of mothers, either pregnant or nursing mothers. And so the AAP's chapters are taking it on as their responsibility to inform the medical directors and the insurance commissioners and so forth that these are some of the essential health benefits that are necessary, and we're happy to work with other folks like you, as you well know, at the chapter level to try and make sure that the states are following the intent of the Affordable Care Act, and I think it's critically important to do that.
Thank you, Tom.
Can I just make a quick comment on that?
Please do.
Sorry. So just as we work with our Title V directors, Margie Dimes chapters work all the time with AAP and with ACOG chapters and regions, and because we do share so many of the same priorities.
Right.
On that implementation, some of the areas where we're all working together include not just essential health benefits, of course, but networks.
Yep.
And making sure that the networks aren't artificially narrow, and actually also quality measures. So realizing that some of the programs are putting in place quality measures, or they're required to put in certain ones, but making sure those perinatal quality measures are in there, because otherwise they do tend to get focused on heart disease and chronic disease and obesity and like you said, all the adult measures. And we keep going in there and saying, you've got to have maternal and child health as well. And so working with the docs is absolutely indispensable when we're able to do that.
Can I just, Carolyn, would you mind giving a brief plug on the National Center for Health Reform implementation?
Yeah, so the AMCHIP, the Association of Maternal and Child Health Programs, established this National Center for Health Reform Implementation. So we work a lot in the similar vein as March of Dimes, but can't be as advocacy-ish sometimes. But anyhow, there's plenty of resources there for states, and a lot of them obviously are tuned toward how the ACA is being implemented in the states, and this breastfeeding fact sheet is just one example, but we have one on 39 weeks and non-medically indicated deliveries and such, and the policy levers at state level. So as we've been talking about, like, what's the next step after the hospital or like out in the communities, this is a lot about how the states are doing this implementation work. So National Center for Health Reform Implementation at amchip.org, or amchip.org, and then look for that national center.
Thank you. Any other comments? Any comments from ACOG or family practice? All right. Well, thank you. I think that concludes our discussion this afternoon.